I will talk about the flexor tendon. So flexor tendon injuries can happen due to a sharp wound or a blunt injury or an attrition injury. The tendons are covered by the tenosynovium. The flexor tendons can be classified by Mardan. Type 1 is a tendon injury which is at the level of A2 pulley. The type 1 injury is the one which is below the insertion of FDS. In these injuries, FDP is involved. Type 2 is or zone 2 injuries are the one from the attachment of FDS till the A1 pulley. Third is the one from the A1 pulley till the carpal tunnel. Type 4 is carpal tunnel and type 5 is in the forearm. So whenever an injury happens, the injury, the most important factors is what type of injury happened. Is it sharp, or it is a blunt wound, or it's an attrition rupture? What is the age of the patient? What is the zone of the patient, zone of the injury, and how much is the delay? So for any injuries, the tendons heals with intrinsic or extrinsic healing. Our all principles will follow to have a healing which is intrinsic healing. Normally, the tendons, when it's disrupted, we need to examine the wound. Regarding the separate classification of all the injuries, zone 1 injuries are basically either jersey fingers injuries. It can happen while abrupt extension of the thumb of the fingers while trying to go towards extension. It's basically classified as a jersey finger and classified as Leddy-Pecker classification. Type 1 injuries are those which are at the level of the tendon is at the level of A1 pulley. These injuries will disrupt vincula, so would need to be repaired early. Type 2 injuries are those which are at the level of A2 pulley. Type 3 injuries are at the level of A4 pulley. Type 5 injuries are those which are which have periosteal avulsion itself. The highest, the Leddy-Pecker classification, the early operative intervention is indicated. The reason is being that vincula is disrupted. The surgical intervention in the form of acute would be fixation with a buttonhole on the dorsum of the nail bed. Regarding the A2 pulley, A2A zone, A2 zone, zone 2, the problem which can happen is that the pulleys might be involved. So therefore, a zone 2 of Vardhan is sometimes called no man's land on some man's land. The important thought process is, number one, whether to repair FDS and FDP together. Number 2 is when to repair it. And number 3, how to address the the pulley injuries. So thought process is that it's been indicated that early intervention is indicated. The early intervention is better because it allow optimal healing as the tendons have not retracted. In any case, if there is a pulley injury, we have to reconstruct A2 and A4 pulley. The reason being is the bowstring can cause delayed bowstring would cause reduced function of the fingers and excursion. A slip of FDS can be utilized to make pulley itself. If the injury is more than 4 weeks old, I would prefer to do two-stage reconstruction. A two-stage reconstruction consists of first type stage one in with respect to placing a silicone tubings, and then after in second stage, when a good canal is produced, then we can put a graft. A graft can be palmaris longus graft or plantaris graft itself. This stage 2 reconstruction should be done at the 8 weeks cap. Zone 3 injuries are basically complicated with respect to vascular injuries and nerve injuries. A thorax exploration is indicated. Zone 4 is the one which is involving transverse carpal ligament and can be seen as spaghetti disc. The zone 4 injuries, that is transverse carpal ligament injuries, there is importance is that the difference is that the position of the wrist is also important. Wherever a dissection is done and repair is done, the wrist might need to be in the flexion position instead of Edinburgh position. Edinburgh position is basically extension of 20 degrees at the wrist joint and the metacarphalangeal joint at 9 degrees and the interphalangeal joint at extension.